ani director of health service me alon ka nyanda mabel para man ala bundale nyinti wol fanan salon ko na do kula kar me nga samba gunjur waranto brikama waranto jamme foundation waranto akete dawdati amantara do ko wala nyama salon ni o mari be tambila nyoy nyame
yamin fa kuma ya tabake coming ka mol nyinin ka yamin mira why put la chala misenjay dafa am any reward or punishment bo xamne dañ ko def pour medical practitioners yu nek ci Gambia bi in the system?
Yeah, in the system bobu dañ koy def toujours ñoo xamne ñu ngi liggéey lu baax te non ci baax nañ te am nañ jikko yu baax dañ leen jox reward waaye mo tam ñoo xamne dañ def lu bon dañ leen jox penalties moy ida dañ na suspend o ma ñu daxala loolu daf tay am te loolu fu nekk na nekk te loolu bo lañ ñu ko dégal ministre comme daw lu mu wax rek nga dem l'hôpital bo xamne ñu la jox jikko bo xamne baaxul nga dem am ci complaint box bu ñu def fu nekk lañ ko def ci l'hôpital bi ak ministre of health nga dem dugal ko fofu su boba so complaint dañu dem investigation bu ñu defee investigation bu gis na dal nos nanga mo la jox problème bi dañu gis na dal loi bi tag nañ ko ci mom.
There is an increase in concern from the general public with regards to clinical fatalities due to human error. What are some of the things that you're doing to prevent these things?
For all practice, you know, we have guidelines. We have clinical guidelines. We have rules of engagement when it comes to medical services. In fact, there is a Medical Services Act which specifies all this. If during the course of his or her duty a doctor makes an error, that's subject to a review, because that case needs to be reviewed and investigated. And the report is usually sent to the ministry and also to the councils, because you have a medical and dental council who are primarily responsible, you know, to regulate, you know, medical practice and care, and they support the ministry in this regard, because these are professionals who have been in the service, and most of them are veterans. Similarly, also when it comes to the nurses, the nursing practice is also under the nursing council. So all malpractices or any injuries that may be caused to a patient, you know, once it is reported, should be immediately investigated, and the disciplinary proceedings should now be levied by these bodies.
There are also stories that people say, like in the hospital, in our main hospital, to be specific, that during very critical times like operation and that, there will be power shortages.
As I mentioned earlier, the health system is very complex, because it's not about drugs, equipment, medicines, you know, and all our medical applications. It's also about utility services, water, electricity, gas. All these things are needed, you know, to ensure that we achieve a better outcome when it comes to treatment. Usually these things do happen, but now because of this, I will inform you that 2 weeks or 3 weeks back, NAWEC management has now come closer to the Ministry of Health. In fact, we are now into partnership. They are now going around assessing all our health facilities in terms of electricity needs. They are also looking at backstopping. Because most of the time when major operations are being done, which is very dangerous, because imagine when somebody is under the knife and power just goes off, you know, and then, you know, somebody is under anesthesia, you know, is half dead, power goes off. That patient can die. All major facilities, all major minor health facilities have been fitted with backup generators. Sometimes you have operational difficulties in making sure the right person who is going to switch off the backup generator is not available. So sometimes it's about communication. And that's why NAWEC is being engaged to make sure that our systems are on high alert.
But instances like that, what would happen? Would the doctor be dismissed?
Well, the doctor may not, the doctor in that instance...
Or the person in charge, because, I mean, he's doing the operation. He's not taking care of the electricity or some...
Well, I don't think per se you can put the blame squarely on the clinicians at that stage. This is about power supply which does not come from the Ministry of Health. We know it comes from a national company. But as I said, this has been recognized by NAWEC, and they are putting up measures. Right now, they've already gone around the country, and they're helping us to make sure that once their system is off, because they can also go off by accident. Something can happen within their system for which they are not responsible for, or they can have no control over. And then these things happen. But being aware of it, they are now putting us on a switch over channels, so that our generators automatically can switch on to power. And I think this was in-depthly discussed, and we had a roadmap already. This is also recognized, of course, by the president himself. And he has given directives to make sure that electricity is stabilized in the ministry.
The healthcare system, it's too big. We can't discuss in 45 minutes or half an hour. We'll have to invite you back to come on the show, and we can discuss more about other issues as well. But before we go, just say your last word to the general public.
The efforts of the Minister of Health need to be recognized in the sense that now we have reduced the referral loads, or the load on the RBTH in terms of referrals. Now most of the operations are done in Brikama and in Serekunda, SL, Farafenya and Soma. So those things are fully operational. So that is why, in fact, you can see we are reducing the load on the hospital. And then as we go along, our aim is not to have even a single referral from these peripheral hospitals to the main referral hospital. And we are really doing very well in that area. So
that's good.
My last word is that health is wealth. And that's the cornerstone of our policy. But just to remind the general public also that health services in this country is almost highly subsidized. It's nothing. $5 fees, you get all the drugs. I remember going to a private pharmacy recently myself. And I said, okay, I was going to buy Quatem. This is anti-malarial. I mean, it cost me $350, Gambian dollars. Contrary, when you go to our health facility, you get these almost at $5.
Really?
So, really? So, and this has not changed since 1988 when the user charges were introduced. So, I think there is a general concern that also the health financing needs to be looked at, and this is what we are now doing to make sure that all the other inputs like drugs and so on are also available, because they all go along to complement quality, without which, of course, you can't say there is quality health care, because you can't imagine going to a health facility and say we are out of drugs. But how much are we also putting in?
That's true.
And we are also thinking of establishing a health insurance very soon.
Thank you. That was Mr. Cisse and Jai from the Ministry of Health and Social Welfare. I mean, we talked about a lot of things, but hopefully we'll invite them another time. And then if you have any questions, any concern, you can always contact us. And the number to call is 666-7469. The Fatu Show is partly sponsored by Comium. But before we leave, I have the Roots Bongo Band in the studio. They will give us entertainment before we leave. Hi, Nina.
Hi.
It's good to have you on the show again.
Thank you. Good to be here.
And what's new? You have a new single, I heard.
Yes. We've been promoting the album that we released in January. That's Leaders of Tomorrow from the Roots Bongo Band. This is for you, this copy.
Thank you. Thanks a lot.
Thank you for having us. And now in the meantime, we have been working on a African album. And we just want to give the people a taste of what they can expect to come from us. So this is our first single in Mandinka. It's a love song.
Nandin Savario